split our video in half here. So we're back here, and I'm just going to do my second measurement for your diaphragmatic excursion. So take those 2 deep breaths for me and hold the second one after you breathe out. Okay, and we mark that one. And we do the same on the other side, and they come out even within normal limits. And now we're going to move to your anterior chest, and we notice that everything is symmetrical here. Just like I said before, we'd be in the hospital gown or without a shirt on so that we could see everything. I don't see anything wrong with your skin. I don't see any bruising or any edema or lesions. Everything looks good. And then we're going to measure excursion out in the front. And take a couple deep breaths for me. Okay, good. And palpating again for any tenderness, any lumps or bumps, or any crepitus, and feeling all these lymph nodes. I know you're ticklish, but we would check your armpits as well. The axilla. All right. Gonna go ahead and listen to a couple lung sounds. I'll start in the back here. Okay. All right. And the lungs are clear. I don't hear any abnormal sounds. And we will move to the front. Okay, good. And now assessing your heart, I'm just going to feel for your PMI. So we move down to your 5th intercostal space and the mid-clavicular line. And that can be palpated right to the left of the mid-clavicular line, this intercostal space. And now we're going to listen to your heart. Different places. Okay, regular rate and rhythm. Heart rate of 82. I hear S1 and S2. It's good and crisp. I don't hear any diminishing or any accentuated sounds. And I don't hear any S3 or S4 murmurs. We also do this with him lying on his left side. And we'll do that here in just a minute. I'm just going to, while you're sitting up here first, I'm going to take your blood pressure. And just for time constraints, we're only going to take it in one arm, but if we could do a nice assessment, we would do it in both arms and calves. Okay. Oh, maybe we should do this other one. Okay, because I'll forget and I'll whack it. And just pretend we're doing your pulse ox on this and just rest your arm. Good oxygen saturation, 98%. Just check your pulse. We will check your radial pulses and your brachial. Good. 2+ and even. Symmetrical. Your blood pressure is good.
What is it?
129/60. All right. Sleep up here too. Alright. Now I'm going to move all these keys. And then you can lay down. Okay. Go ahead and lay down for me.
Which way?
It doesn't matter, either way. I can put my stuff back up that way. Alright.
I don't need that.
Well, let's see.
Oh,
I guess we are at a good angle there. Alright. So now that you're lying down, I'm going to look at your jugular veins again in the neck. So I'm going to have you turn your chin that way for me. And now we can visualize your jugular vein there. And I can actually see it pulsating. And we're going to measure your central venous pressure. Got my ruler here. And I'm just going to measure here. Oh, I need a piece of paper. Go across here. And measure this. And we're at 3 centimeters, which is normal. And I would have him roll over on his left side and listen to his heart, but because of how we're situated, we're just going to stay flat. And his heart would sound the same. I wouldn't hear any murmurs. All of his S1 and S2 would sound fine and crisp. I wouldn't have any diminishing or anything louder than normal. Lying here, we're going to go ahead and check out your belly. Check your abdomen. I noticed that his skin tone is even. I don't see any bruising or lesions or anything. I'm going to go ahead and listen first. And we have vowel sounds in all 4 quadrants. Good. I don't. And listening to vascular, I don't hear any. I can't hear anything from his aorta, which is good. Alrighty. And we're going to percuss the stomach now. And hearing mostly tympanic sounds. Then we are going to measure his liver span. Percuss again. And we'll get our pen and mark it. And then we're going to go down, measure the other end. Alright. And we get our ruler and measure. And we are looking at 7 centimeters, which is normal. Alright. And now we're just going to palpate your stomach. You let me know if you have any tenderness, okay?
no.
Everything is soft and non-tender. I don't feel any abnormal masses or anything. I'm going to measure your aorta. Can you feel it? And we're at about 2 to 2.5 centimeters, which is normal. And now we're going to feel for your liver. And the tip is sharp and it is movable. And And then we can feel for your spleen. And sometimes we can feel it and sometimes we can't. Can't palpate the spleen. And then we check your kidneys. And you can feel sharp edge and movable. Any pain or anything with this?
No.
Okay. Okay. Alrighty. That's good. Alright. And now I'm going to have you, while you're still laying down, if you can bring your toes up to your nose and take them all the way back down. Okay. Now we're going to go against my hands. Go ahead. Okay. Alright. And lift your legs up off the table. Good. And this one. Good. And bend your knees one at a time for me up. Good. And this one. Very good. Alright. Bring it back down. Alright. I think you can go ahead and sit up now. We're done with this part. So be on up here. Okay. Alright. And we're looking at your legs. His skin looks good. He has normal hair distribution. I don't see any discoloration in pigment, no dry peeling skin or ulcers or anything. No varicosities. His skin is warm and dry. Alrighty. His toenails look good and well kept. Alright. Now we're just going to do the last part. I'm just going to have you stand up. I'm just going to check your gait and balance. Get up okay? Alright. Okay. Just looking at your posture. He's standing up straight. I'm going to have you bend all the way down as far as you can to touch your toes. We're just checking to make sure no scoliosis. So the spine looks good. I don't see any abnormal curvature or scoliosis. Alright. I'm going to have you close your eyes and try to stand on one foot for me. When he's on both feet, he's not swaying or falling over. Good. And the other. Alright. Okay. And then I'm just going to have you open your eyes. And I just want you to walk towards me, but bring one foot in front of the other and touch the toes. Heel to toe. Good job. Alright. I believe we're all done, Paul. Thank you so much.
Thank you.